Inclusion, equity, and diversity. Nursing is holistic, thinks about the whole patient, requires skills and knowledge for diverse populations. As a nurse, we need to show sensitivity, promote safe, respectable, and ethical practice, and contribute to reducing health disparities. In 2015, the American Nurses Association Standard 8, titled Culturally Congruent Practice, provides a framework that guides nurses to be culturally competent role models and leaders. Culture for nurses is defined as an integration of human behaviors. These behaviors may be communication, language, actions, beliefs, values, customs, institutions of either racial, religious, social, and/or ethnic groups. Culture is considered a major part of every client's life. Cultural awareness is the ability and willingness to investigate and understand the differences between perceptions, beliefs, traditions, and values within one's own culture, and to become aware of one's self-bias to enhance cultural awareness when caring for individuals. Self-bias is part of each nurse's or medical professional's implicit or unconscious bias. As a nurse, recognizing it requires understanding one's own cultural views, assumptions, values, and beliefs. Everyone has biases. Cultural diversity is a broad range of individual, population, and social characteristics. These include age, ethnicity, gender identity, geographic location, language, and religious beliefs, as well as socioeconomic status. Cultural competence. This includes positive and open communication and open feedback. This requires appreciating, accepting, and respecting individual cultural influences, beliefs, customs, and values. Emic knowledge is a cultural insider's perspective on a culture. Etic knowledge is an outsider's viewpoint on or related to a specific culture. Health disparities are health outcomes that are varied among various populations as well as vulnerable groups compared to the majority or the dominant population. Health disparities can negatively affect populations of individuals, and they may experience obstacles to health as well as obstacles to access care. Various factors affect access to care for vulnerable populations. Transportation, healthcare, religion, physical disabilities, mental health, cognitive disabilities, socioeconomic status, as well as race. Health equity is attaining the highest level of health for all individuals. This requires society's efforts to value everyone equally, addressing avoidable inequalities, and eliminating health as well as care disparities. Health equality is a distribution of resources to all individuals within a population. Vulnerable populations are individuals at a higher risk for poor health outcomes. may be due to barriers related to social, economic, and environmental resources. Demographic characteristics related to vulnerable populations may be age, language, household type, population density, race, ethnicity, or sexuality. Health status related to chronic health conditions and disabilities. For these populations that can be affected by any health insurance status, socioeconomic factors that include education, employment, household income, and poverty status, or any disabilities. Cultural health assessments assist the nurse in planning and providing culturally competent nursing care, and it is often difficult to remember the details of every culture that comes to the United States. Sometimes there's a language barrier, and as a nurse, you should use a certified medical interpreter to make sure that the communication is clear for the patient as well as the medical professional. Nurses are able to use various cultural assessment tools to help gather information about the essential elements of their client's culture. Values, beliefs, and practices for culturally related care are shaped and embedded in worldview, language, spiritual, social, political, educational, economic, technological, ethnohistorical, and environmental spheres. Human care is universal across cultures. It is demonstrated by diverse expressions, actions, patterns, lifestyles, and meanings. All cultures have folk or generic health practices. Care for individuals is distinct, dominant, unifying, and the central focus of nursing. And care may always occur without any cure. Care and caring are essential for human survival, growth, health, well-being, healing, and the ability to deal with any handicaps or death. Nursing is considered a transcultural care discipline and profession. The central purpose of serving human beings in all areas is nursing. Nursing care is beneficial if the nurse knows the individual patient's patterns, expressions, and cultural values. If individuals receive care that is not compatible and respectable with their life values, beliefs, and ideas, the individual will then demonstrate distress, cultural conflicts, ethical or moral concerns, or non-compliance.